We'll be out there.
In the News 10
So come
booth.
say hi.
Yeah, come say hi. We'd like to see you. Yeah. Well, with an ounce of prevention, while an ounce of prevention may be worth a pound of cure, identifying health problems early on can also be life-saving because the earlier it's caught, the more effective the treatment.
That's right. Detecting health problems like heart disease or even cancer is exactly what our next guest can help you do. Dr. Dennis Breen with Sacramento Heart is here with us once again, and good morning to you.
Good morning, Kristen. Good morning, Guy.
Yeah, thanks for being here.
It's great to be back.
Now, tell us right off the top, what exactly is a body scan?
Well, a body scan is a marvelous recent invention marrying the technologies of the best 64-slice CT scanner with the best of computer technology. And that allows us, without needles or pain or suffering, to take pictures of all of the important organs of the body. And with that, we can find a lot of useful information.
Now, who should get a heart scan and why?
The people who need heart scans are people who are above the childbearing age, because there is radiation. We don't like to do this on women of childbearing age, so that's the first thing to remember. So older people, generally people over 50, let's say, especially people who have been exposed to cigarette smoke, secondhand smoke, or former smokers, people who've had a history in the family of cancer. This is a very good way to detect cancer and heart disease early on.
Is that really the big reason why a lot of people do it?
That's the main reason, really. Heart disease and cancer.
So how much more effective is this at detecting things like cancer and heart disease than traditional?
Well, let me put it this way. By the time you can feel a lump somewhere in your body, or by the time you're coughing blood or losing weight, it's too late usually with cancer. That's why our batting average with cancer is so poor. If we could find cancer before anyone knows they had it, it would be curable most of the time.
Now, what about costs involved and insurance?
Insurance.
A lot of insurance companies do not cover a body
That's
scan.
the big problem today. There is, unfortunately, a tendency for insurers not to pay for preventive medicine testing. And that's, I think, going to change in the future, but right now we're still wrestling with that problem. So this is an out-of-pocket cost for consumers.
Now tell me about something called a coronary calcium score.
That's
What
right.
is it, and why should we know about it?
It's an important part of the body scan, and what it is it's a picture of the heart looking for the presence of calcium deposits within the coronary arteries. Normally they shouldn't be there. If calcium deposits appear in the coronary arteries, it often is a marker for cholesterol, and that's what we're looking for. Cholesterol can cause blockages. Blockages can cause heart attacks.
So there are a lot of things you can identify with a body scan.
A lot of things.
Now, in the healthcare world, there is some division over the value of body scans.
Indeed. It's still a little controversial. There has been some criticism leveled against this. First of all, because people sometimes think that it's better not to fix what isn't broken. Well, we don't agree with that, because if you maintained your car that way, you'd have some very expensive repairs by the time you realized there were problems. So we believe that prevention is well worth the cost. And if you do find things that are abnormal, which many times we do, we have ways of dealing with these, which involve sometimes repeating the picture at a later date, just to see if there has been any change.
Okay. Now, what's the process like? Is it pretty quick? What happens when somebody comes in for a body scan?
The process is as simple as lying on a table and sliding through a donut-shaped metal ring. It's not claustrophobic. It's not a container that makes people frightened. It's you don't even have to get undressed for this. There are no IVs. There are no needles. It's as painless as laying on your bed.
How long does it take?
About 15 minutes.
Okay. And then when do you get results?
The results are interpreted by a board-certified radiologist, and then the individual has a meeting with a doctor in our office to sit down and discuss the results, usually a week or two later.
Okay, because that's the hard part, is waiting.
Yeah, for the results.
Yeah, for your answer.
Well, sometimes it is hard, but we do need time for these results to be completely analyzed and interpreted.
Sure.
And then we do like to have a face-to-face chance to sit down and interpret the results to translate the medicalese into English.